This is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia. I'm going to discuss home ketamine therapies, both oral and intranasal ketamine, as well as a little bit about IV therapies for seasonal affective disorder, otherwise known as seasonal depression. So we're coming up on the fall season and, of course, winter, and there's an increased risk of depressive episodes due to changes in the length of daylight and the increasing length of nighttime. And this can affect about 5% of the population in the form of worsened depression or new onset depression. Sometimes it could be so severe that individuals will even have thoughts of self-harm. So this is a significant problem in the population, and it's one that is not frequently addressed as vigorously as it should be. So there are rapid treatment options for depression that are available and for seasonal affective disorder. Now, many patients will be using medications such as bupropion, otherwise known as Wellbutrin, in the fall and winter months to help treat seasonal affective disorder or depression. But others find that their traditional antidepressants just don't seem to really make a big difference in terms of the depression that they get in the fall months. And so the question is, what do you do? Do you change your antidepressants or do you add other medications to it? Now, the problem with antidepressants is they can take many weeks to work if they work at all. And then there's side effects such as sexual side effects, weight gain, and anhedonia, which is basically emotional numbness. You just don't feel anything at all. You feel kind of dead to the world. So why not reach for an option such as ketamine therapies, both in the form of infusions and at-home oral and intranasal ketamine to help augment your traditional antidepressants, or just to help get you through the winter months and the fall months whenever the depression starts to settle in. Now, we know that intravenous therapies are highly effective in about 60 to 70% of the population, with a short series of infusions producing remission or significant improvement within a few infusions. But then there's also at-home ketamine therapies in the form of ketamine troches, ketamine RDTs, otherwise known as ready-to-dissolve tablets, and ketamine sustained-release capsules, as well as ketamine dots, and at-home ketamine nasal spray, which is a combination of right and left-handed ketamine. It's a little bit different than Spravato, which is the FDA-approved version of in-office ketamine that is S-ketamine only. It's only half of the racemic mixture of ketamine that is significantly helpful in the treatment of depression. So ketamine troches are waxy ketamine-based treatments that are available to augment your underlying antidepressant therapy. And they can be used, of course, alone as well without traditional antidepressants. But they certainly can help make your antidepressant therapy work faster and better. And they can be also used for the purposes of relief of depressive symptoms as well as anxiety. Now, they generally taste pretty bad, and they can certainly be flavored with just about anything you want, but for some reason they still taste pretty bad overall. But just to let you know, troches and non-IV therapies produce relief, but seldomly produce remission. And they also take a lot longer to work relative to IV therapies. Now, I mentioned ketamine troches are kind of waxy substances. You place it under your tongue or between your cheek and gum at the prescriptive dose. And generally you hold it there for about 10 minutes and you allow it to dissolve. It's absorbed through the veins in the mouth and also through the mucous membranes. Its effects are generally seen within 5 to 10 minutes, and it's rapidly absorbed to the extent of about 20%. So you get a large dose within a short period of time. But just remember that the altered states that you may achieve with this can certainly last a lot longer, and they're not as well controlled as with an IV drip. So if you took a 100 milligram troche, you'll get 20% of that, maybe 20 milligrams, within just a few minutes of putting it under your tongue, while an IV drip may be giving you a milligram per minute over the course of 40 to 60 minutes. Now, there are two options for using ketamine troches in the way that you utilize it. One is to allow the troche to dissolve, and then you would spit it out after about 10 minutes. And this kind of prevents you from having stomach cramps and also getting the nausea that some people get when they swallow the ketamine. The second option is to swallow the ketamine after you dissolve it under your tongue. And this certainly increases the total dose that you'll receive, but it also increases the chance of some nausea as well. But you will get a second journey. Now, the strength of the ketamine troche can vary based on your needs, and it's tailored based on your prescription as sent to a compounding pharmacy. The physician can determine the frequency and the use of your ketamine troche in the context with which you use it. So there are a lot of individuals using ketamine for ketamine-assisted psychotherapy, as well as the use for depression and anxiety disorders and other mood disorders that at home. Now, we find that it's best to use escalating doses. You start low and you increase it to effect because you really don't know how you're going to be absorbing this initially. It's better to have a good experience than a bad one. And the goal really is improvements in symptoms and functionality. This isn't about a journey. So we generally choose doses for its microdosing effects, meaning you don't really notice any altered sensorium. In fact, you shouldn't notice anything at all. Some patients, however, do feel better by achieving altered states or dissociation. However, it's a little bit harder to control in the home environment. You certainly want to do this in a safe location. So twice or 3 times a week, individuals can use the home therapies for a standard type treatment for depression or mood disorders. This kind of emulates what IV sessions are. However, the number of times an individual uses it per week really varies based on their clinical presentation. Now, recognize these are compounded products, so follow the prescription, and you'll notice that you'll have different experiences based on the compounder, their method of preparation, what you've eaten recently, and what your status is prior to using the treatment, if you're stressed out or if you're relaxed, and sometimes how you absorb it. Just do it a little bit differently from time to time. So again, you can't really base your results based on the signal of ketamine, that you didn't feel anything or you didn't feel trippiness or too much, but rather how are you doing the next day or several hours later. So the dose can vary anywhere from 25 milligrams to several hundred milligrams per troche based on the patient's needs and their experience. And some patients do feel the need to dissociate in order to get relief. However, microdosing of ketamine with minimal psychedelic effects can certainly be quite effective in providing relief of depression and anxiety symptoms. Recall that 20% of the ketamine dose is absorbed through the mouth in a troche form, and that effectively, if you took a 100 milligram troche, about 20 milligrams is absorbed really quickly in a few minutes. So that could be quite intense for some individuals. So it's better to start on the lower dose. And remember, an IV infusion can produce or provide 100% bioavailability. And generally, you might be receiving a milligram per minute over 40 or 50 minutes. And so you get an intense experience, but it's not necessarily overwhelming. And it could certainly be controlled a lot better than just using oral therapies. Now, at-home therapies don't provide the effectiveness of IV therapies. So you need to think about, examples of where IVs work better, such as an infection. If you have a skin infection and oral antibiotics don't work well, which we frequently find, sometimes you have to use IV therapies because the pharmacokinetics are different, the way that the medication distributes inside your blood and goes into the brain. Again, the example of IV therapies of antibiotics for a skin infection versus oral antibiotics are clearly an example of why IV therapies do work better. The same thing with IV hydration for patients who are dehydrated. Now, there's also ketamine RDTs, or ready-to-dissolve tablets, and these are chalky, explosive tablets that also go under the tongue. And they break apart rapidly, and they release ketamine rapidly. Now, this just provides enhanced absorption, and they can be compounded in a number of different strengths, anywhere from 20 milligrams to up to 200 milligrams. Now, the upside of home ketamine treatments is effectively you can control your treatment and its timing. It also provides relief of symptoms rapidly, allows your medications and psychotherapy to potentially work better and faster. And also it can help treat anhedonia, the lack of feelings that come as a side effect of traditional medication support and traditional antidepressants. It also allows you to basically provide time for meditation, reflection, better insight, and reframing problems so that you can have breakthrough thought processes. It can also get you through the tough times of the year when you are spiraling. And you can also mix these at-home therapies with IV therapies for enhanced results and better remission, in which you have no symptoms, but effectively do need medication support to maintain that level of functionality. Now, the downside to home ketamine therapy is that certainly you can get side effects such as nausea, dizziness, and cramping. I suggest that you have available Zofran, which is a medication for vomiting, or a scopolamine patch, even some Bentyl for stomach cramping to help moderate the side effects. Also, if you use ketamine late at night or towards the evening, it can keep you awake because it's kind of activating. And, of course, sometimes the dose may be enhanced, and so you may dissociate. So it's important to use this at home only in a safe environment, not in a bathtub. And you can't drive for 4 to 6 hours, if not longer, after utilizing this treatment. And also, it might not work as well as IV therapies, and it may take a lot longer for at-home therapies to show effectiveness or peak performance. But it certainly can give you relief. However, it is less likely to give you remission. So you could expect, again, some response, but again, you might not get remission, so you may need to continue this therapy. And the final problem is the cost, because each tablet or troche can be anywhere from $7 to $12 per tablet or troche. The other issue is that you have to realize that you're not going to get a change in certain aspects of your mental health, which includes your behaviors and habits. That's something that medications can't medicate away. So you basically have to work on that with your therapist and use the internal healer to kind of change those behaviors you've developed because of the mood. So, for example, we can't medicate you to like your job or clean the house. You also have to realize this is a treatment, not a cure. So you're going to need to have follow-up therapies as well. Now, there's also ketamine sustained release capsules, and these are long-acting capsules that work well for pain treatment through a delayed release formulation. There's also ketamine dots, which is a mixture of ketamine, Zofran, which is ondansetron, a nausea medication, and midazolam, which is a sedative benzodiazepine. And it's used for periodic use for panic attacks and relaxation. So again, periodic use only. And so the ketamine oral medications, certainly with ketamine dots, works in the setting of acute anxiety and panic, but not always for everyday use. So you don't want to use ketamine dots for day-to-day use, only really for the acute panic and anxiety attacks that you may suffer from. And these ketamine dots are certainly waxy, troche-like in consistency, and they're placed under the tongue, and they're melted and held there for about 10 minutes. Then you spit them out. And again, it's a similar use as other therapies that we've been discussing. And finally, there's ketamine nasal spray, which is basically a compounded racemic mixture of right and left-handed ketamine. And it's used per your prescription, anywhere from 5 milligrams per spray up to 20 milligrams per spray. So each nasal spray is about 0.1 mLs, and it's based on the compounded formula. So you can use the nasal spray alone or to augment the effects of the oral formulations. It's very helpful for CAP sessions, ketamine-assisted psychotherapy sessions, in which you can use oral ketamine first and then augment it with nasal spray to help maintain the effective duration of the CAP session. Kind of lubricates the psychotherapy process by using small sprays throughout the session. Now, ketamine nasal spray provides 40 to 60% rapid absorption, so its effects can be seen rapidly. And also, it's still not as effective as IV infusions. And there is the side effects of burning and the nausea, being off balance, and cramping that you get with oral therapies. Now, we do know that ketamine infusions are the most effective and rapid treatment that can produce remission and response in depression and anxiety disorders. IVs are always the most effective route. It's 100% bioavailable, and pharmacokinetics and drug distribution allow the best peak performance. It's controlled literally by an on and off switch. So if the person has any problems, you just shut it off, and within minutes the person's back to normal. But it is more expensive. However, it can control the trippiness by basically slowing down or speeding up the treatment process. And certainly intramuscular shots can be used for treatment, but few studies have demonstrated efficacy. But we have seen it work well in some individuals, especially those when they have poor IV access. But the problem is, once it's injected, you can't take it back. So if the person has nausea or glottic spasms or anxiety, then you may have some issues there in kind of dealing with that. And you can't take that medication out. The other thing is that you also may need to inject several times to get the desired effect. So this does distribute differently than IV formulations. Now, you don't have to lose control during an infusion to get the ultimate effect or functionality of antidepressant effects from ketamine. So there's no association with dissociation for most patients. So again, you don't have to lose control. Now, a ketamine bottle shown here has about 500 milligrams in it, and that's enough to treat 5 to 10 patients. And yet a troche can have 100 to 200 milligrams. So 2 troches equals 1 of these bottles. So, again, it just goes to show the power of IV versus oral ketamine. So again, oral ketamine just doesn't reach your system as an IV infusion does. And so trying to raise oral doses high enough to emulate an infusion really risks a large absorption and also scary outcomes from time to time. So again, the goal here is just to increase a person's neuroplasticity and improve basically their symptoms. Now, for seasonal depression, a series of 6 infusions, and sometimes less, can result in rapid reduction of symptoms and sometimes remission as well. So you can get a significant response when you're spiraling, especially during the fall and winter months. Now, there aren't really any randomized controlled trials that I'm aware of for ketamine use in seasonal affective disorder, but it is a form of depression, and depression uniquely responds to ketamine infusions, usually between 4 and 6 infusions in about 60 to 70% of patients. So each infusion is about 40 to 50 minutes, and usually you get 2 to 3 infusions per week for a series of 6 infusions. Sometimes people can use less, and sometimes they'll need more. Now, you need to recognize that you'll need to have a driver come with you because you can't drive afterwards, but it is an extremely safe treatment, and low doses are used relative to those used in anesthetic purposes. And you can certainly maintain the effectiveness of IV therapies by at-home therapies and booster infusions, whether it's monthly or sooner when needed. Now, don't forget that you need to use psychotherapy, exercise, getting outside, and supplements such as vitamin D if appropriate, dietary changes, and indoor light therapy to help maximize results, as well as other alternative and integrative therapies.